Good evening, Berkeley. I am your mayor, Jesse Adegain, and welcome to this virtual town hall meeting on the City of Berkeley's response to the COVID-19 pandemic. I'm very pleased to be joined by a panel of city leaders, including our City of Berkeley Public Health Officer, Dr. Lisa Hernandez, City Manager Dee Williams Ridley, and the Director of the Department of Health, Housing, and Community Services, Dr. Lisa Varhus, all of which are very actively involved in the city's response to COVID-19, mobilizing the entire city organization to address this public health crisis. And I just want to once again give particular thanks to Dr. Hernandez. We know that the job of being a public health officer is a very challenging job. And I'm sure when Dr. Hernandez signed up, she was not expecting that she would be in a months-long pandemic, but we're so fortunate to have an experienced, compassionate, dedicated leader helping lead our public response to this pandemic. And I think it's part of the reason why we have been able to effectively control the spread of this virus. And it's all the more important now as we're entering the next few months, as we are seeing an increase in cases. Tonight's town hall comes at a very challenging time in this pandemic. We all were able to gather together, hopefully safely, and also following the public health guidance to celebrate Thanksgiving. While we're all thankful to be here and to be healthy, we also know that we are going to see an increase in cases as a result of the holiday season. We are already seeing an increase of cases nationally and also here in the city of Berkeley. And we expect that the case rates to continue to increase. Governor Newsom today provided a pretty sober briefing as part of his daily briefing on the state's COVID response. And stated that without further public health interventions, and if the pandemic continues at its current rate, the state will hit intensive care capacity by mid-December and will be over capacity by Christmas Eve. And this forecast comes at the end of a very challenging month, and we know that we're expecting even more cases in December. The state reported 9,500 cases a day for November. That's triple the rate of October, and certainly over the previous monthly rate of 8,700 cases in July. And over the past week, case rates have swelled to nearly 14,000 cases a day. So that just illustrates the growing number of cases statewide and also here in the Bay Area. As a result, I think almost nearly every county in California has now moved to the purple tier, although there are some that are not. In the Bay Area, I think nearly every county is now in the purple tier, including here in Alameda County, which means that we have put in place certain restrictions around business activity and around lifting of the shelter-in-place order. And we need to continue to be vigilant to shelter in place, to practice physical distancing, to wear a face covering, to follow the public health guidance in order for us to control the spread of this virus. It's not just to keep you safe, not just about us, it's about our whole community. And I've just been so incredibly amazed at how our communities has really responded to this crisis, not just caring for each other, but also really taking this very seriously. And as we're entering these next few weeks and months, we must continue to be vigilant and take this seriously. So with that sort of preface, I want to turn the floor over to Dr. Hernandez. And Dr. Hernandez, if you can give us an update on the number of cases in the city of Berkeley, as well as any modifications to recent health orders and any of the information you'd like to share with the Berkeley community.
Sure. Good evening, Mr. Mayor and Berkeley community. I will touch on, I'll go with the numbers first, and then I will touch on a number of the points that you already shared with the community about the current situation. I was trying to think of a good description. Sobering really is the best description of the situation we're in right now. So let me start with the numbers. For Alameda County, there are now, and this is not including City of Berkeley data, 28,510 cases and 503 deaths. And I'm going to also talk a little bit about two other indicators that the state uses to put counties into their tier status. And it also helps us look at how disease is trending in our communities. One is the case rate. And the case rate is the number of new cases of COVID-19 reported per day per 100,000 of the population. And they use a 7-day average, and they have a delay of 4 days when they report these numbers out publicly. And then I'm also going to talk about test positivity, which is a data point that I've used before here in the town hall. The difference with the state's test positivity is they use a 7-day average as opposed to what we're seeing as a cumulative average, which is the number that I've been reporting to you here in the town hall. So it's a 7-day average. And again, there's a 4-day delay because the delays are used so that the data is cleaned, and we know that cases are attributed to the right jurisdiction, and that the test numbers also are for individuals in our jurisdiction as well. So when we look at the case rate for Alameda County, the case rate is 14.4 cases per day per 100,000. And that's an unadjusted rate. There are adjusted rates if they do some corrections based on how the community is doing with testing certain populations. But unadjusted means the raw number rate is 14.4 cases per day per 100,000. And their test positivity in Alameda County is 3%. When you look at City of Berkeley, let me just go to the case rate and test positivity, and then I'll go to our cases just so you have that comparison side by side. Our case rate, again, is which is cases per day per 100,000, is 17.7 cases per day per 100,000. And our test positivity is at 1.5%. So when you compare that, we're doing better when it comes to the percent positive in terms of our testing numbers. But when you look at our case rate, we're not doing as well. Both numbers are not great numbers at all, but we're not doing very well. And when you look at our corresponding cases, our total cases for the City of Berkeley now are at 1,158. That's an increase of 316 cases from my report to this community on the 9th of November. And we're seeing our trending cases per day at about 12 cases per day. And that's been in the last week. So we're definitely seeing an impact in those numbers. And we're seeing that, and I'll talk a little bit about what we're seeing and what communities we're seeing that in. But basically, our numbers are definitely higher than they've actually been throughout this pandemic. Number of deaths, fortunately, remain at 9. So there's no change there. Our tests reported on City of Berkeley residents are now at 114,853. And our average tests per day over the last week are 766 tests per day. And that, again, that indicator we look at to make sure that we're testing sufficiently, and we've met that for several months. So I just wanted to talk a little bit about what we're seeing in terms of our case increases. In the last 2 weeks, we've seen a 30% increase in our cases. And in the last month, we've seen a 47% increase in cases. And some of that has to do with the outbreak that a number of individuals might have seen reported in the news, which is the outbreak at Golden Gate Fields. That definitely is contributing to our numbers, but it doesn't account for all the disease activity that we're seeing in our community. So we're working on that outbreak with the facility, with California Department of Public Health, and we're ensuring that individuals there are taken care of and that this disease is contained. But we're also worried about the other data, other cases that we're seeing throughout the community. And at this point, what we're seeing is that these numbers are coming from people who are gathering. Again, it's household transmission or small gatherings. So, and that is not unique, again, to City of Berkeley, but that's what we're seeing throughout the region and throughout the state. And there are some worksite outbreaks within the City of Berkeley and throughout the county as well, but most of the numbers are either coming from Golden Gate Field or from these other settings that I mentioned. The other thing I want to talk about very quickly is what the mayor has already mentioned in terms of what we're seeing in terms of our cases. The Department of Public Health, we're working together with the region, the state, to make sure that we are looking at additional strategies to reduce the impact of the cases that we're seeing. Because what was shared with by the governor today, as well is that we're seeing the impact occurring in our hospitals. And as you mentioned, Mr. Mayor, that we could see our capacity in our hospitals be reached or overcome by mid-December. We're also worried about our intensive care unit capacity as well. So that's the other part of our data that we look at as a state, as the public health officials, to look at triggers in terms of how we're doing in terms of controlling this disease. And that's one of the triggers that we're going to be looking at. The other thing that that I want to mention, it's when we look at capacity, it's not just beds, but it's the staff to take care of individuals in the hospitals, in the intensive care units, that we have to look at as well and consider. So that is another factor that we'll be looking at, because we are now in this surge, and we're not alone in this surge. We cannot depend on getting healthcare personnel from other states or other regions in our nation. So, and because we're all pretty much in the same boat. Fortunately, we're able to continue to contain the disease a little bit more than some of the other states in the nation, but we're still in that situation now, and we cannot rely on healthcare personnel from other jurisdictions. So that is another factor that that we're considering when we're making these decisions and projections. As some of you may know, on Saturday, Santa Clara County issued a new health officer order restricting higher risk activities to reduce the likelihood of their hospitals becoming overwhelmed, because they, as LA and other counties in the state, are seeing projections where they are going to reach capacity. Here in Alameda County, we have more capacity at this point, but we are really worried about what we're seeing throughout the state. So Santa Clara instituted rules that actually became effective today for both businesses and residences, which require reduced capacity at stores, retail and grocery, and also limiting hotels to essential travel, and requiring travelers coming into Santa Clara from a distance greater than 150 miles to quarantine for 14 days. We are not considering that here in the county yet, but all factors are being considered both for the county, the City of Berkeley, and the state. So right now, I just want to urge everyone to continue to do the basic strategies that we know controls disease. We are in a situation where we're worse off than we were in the beginning of the pandemic. However, we know what works to flatten the curve. Wearing your face coverings, staying home as much as possible, avoiding mixing with individuals from outside of your household, and maintaining that physical distance. And we mentioned a bit about the holiday, and I hope everyone was able to enjoy the holiday. What recommendations we provided during the Thanksgiving holiday still is something that should be used for when we're celebrating the upcoming holidays for Christmas and New Year. In terms of traveling, the state actually has issued a advisory of staying home and not traveling more than 2 to 3 hours if you have to travel at all. And also to, if you do travel, do not travel with someone who is sick, or do not travel if you are sick. So we know that these are strategies that are going to help us control this, this pandemic for any setting, but especially during the holidays. I will stop there and turn it back to you, Mr. Mayor, and answer whatever questions come in the Q&A session.
Thank you so much. So I'm now going to turn the floor over to our city manager, Dee Williams-Ridley. And Madam City Manager, if you can give us an update on city operations and our response to COVID-19 and any additional information you'd like to share with the Berkeley community.
Thank you, Mr. Mayor. Our work is completely ongoing. We continue to provide the basic municipal services to our community. We still have a huge sector of our workforce that is dedicated and assigned to our EOC. And this has been the longest EOC deployment that we have had in the history of our city, and probably in the history of the state in terms of this type of EOC involvement. It has truly been a difficult task for us all in terms of just maintaining, but also the fact that folks are working from their homes, out of their offices at home. And that thing about feeling isolated is very real to both the community that we serve, as well as our children and youth and our city workforce. We've been on the ground early on with all of our workers from both fire, police, waste management, all of our staff, especially our HHCS team, those that are in our health sector of work, they have been on the ground from the very early onset of this pandemic, and they continue to do so. We've been very fortunate here in the city. We haven't had huge outbreaks of COVID for our city employee and workforce, but we are seeing an increase in terms of small sections where we're seeing folks getting contact with COVID and being and testing positive for COVID virus. So we are still being very vigilant within our workforce and making sure that we stay on top of our hygiene and all the protocols that have been put forth by our health officer. I want to focus on a couple of other things. Number one, our commissions. We have just a wonderful set of community members, 35 plus commissions, and I'm sure I'm getting that number wrong. There's so many. But what we've been doing is allowing our commissions to meet on very critical, important tasks. But now we've expanded that, and we've allowed for a huge number of them to continue meeting, not only to set their agendas for the upcoming year, but also to get them back in pace of meeting. And all of them won't be on a regular, consistent basis, but we are finding a way to move that needle forward. And I'm very excited about that as well. It is amazing that people want to be a part of changes and working with their city and a part of government and services. So we're really excited to try and get those commissions back up and moving. On our unhoused community, we've made some progress in looking at some viable options within the city in which we can look at an outdoor or even a large indoor shelter for our community. That process is underway, and we hope to have something finalized over the next few weeks and definitely after the council recess. That's an important task that council has been working on for a number of months and even up to a year. So we certainly will see that to fruition. It has been difficult in finding a location, but I just want to say to our community that it's important that we all come together and rally around whatever location is selected so that we can help our unhoused community further. And so, but again, progress is being made. And then lastly, we continue to provide showers and resources for our unhoused community and direct support to all of them, just making sure that they are being served from both the mental health, physical health, and also from, the insecurities of food. So we've been very strategic through our EOC and all of our partners. Lifelong, some of our community agencies, they have all rallied around, and especially our clergy and churches here in Berkeley. So that's my update for today, Mr. Mayor, and thank you so much again for hosting, and I hope that everyone had a great Thanksgiving holiday.
Thank you, Madam City Manager. And something we touched upon in a previous town hall meeting, at the end of October, the city manager and the city team gave a very comprehensive presentation about our response to date on COVID-19. And it was a very informative presentation. I learned a lot about the EOC structure and just how, the entire city organization came together to mobilize to respond. As was noted, that response is ongoing. So I want to just encourage Berkeley residents, if you would like to learn more about the citywide sort of response to COVID-19, to check out the City of Berkeley YouTube page on YouTube, and the videos are posted there. So please check it out. So we received a number of questions from the Berkeley community. We want to get to your questions now. And so I want to address the first set of questions to the city manager. I believe Madam City Manager, you have the questions also. So there was a question about from a specific business owner. This individual has a martial arts dance studio, and and Dr. Hernandez may also be able to weigh in on this as well. They're asking, could we, if we follow the mandated protocols, use the building for a one-time retail event? Also, what would the process be if we wanted to begin using one of the rooms in the studio as an office for an essential health worker? So they have an existing space as a martial arts dance studio. They are interested in potentially using the space for a, quote, one-time retail event, and are curious as to whether they could use one of the rooms in the studio as an office for an essential health worker. If you or Dr. Hernandez have any information to share, and we might want to get some additional information from this individual as to the sort of intended use of the space for an event. But that was the question.
Thank you, Mr. Mayor. I certainly will share the platform with Dr. Hernandez in answering the question. Basically, indoor gatherings are not allowed. And I know that we have the ability for indoor work to be performed by essential workers, but to gather for entertainment or for practicing martial arts or dancing, that is not something that is allowed at this time. We do want our community to know how to contact the city if they have questions around what's allowed. Please call our 311 center, our customer service 311, when you have specifics, so they can potentially advise you at that time on any specifics. I will turn it over to Dr. Hernandez if she'd like to add more.
Madam City Manager, you answered the question correctly. There's not it's not permitted. We are in the purple tier at this point, so we are not able to have those types of indoor events. But I think asking those specifics, if there are additional questions based on our response today, I think the best is to contact 311. There is an email that that the person could use as well, and I'm going to read it out. I don't have it memorized, so it's COVID-19, so it's COVID-19 at cityofberkeley.info. So that's where, if there are questions, they can either call 311 or they can use the COVID-19 email, and that also is managed by our amazing team at 311. So it's COVID-19, so it's COVID-19 at cityofberkeley.info.
Thank you.
Thank you very much. There was a question around the sort of increase in cases at Golden Gate Fields that occurred, that we learned about, several weeks ago. And some of this has been reported in Berkeley side. This resident was asking, what was the event that caused the spike in COVID at Golden Gate Fields in Berkeley? I know that we're doing case investigation and sort of understanding the extent of the spread at that particular location, but it sounds like the infections were happening for some time and may have sort of grown. I don't know if there's anything you could share with the Berkeley community, Dr. Hernandez, as to what may have sort of prompted the spread of cases at Golden Gate Fields.
Sure. I would say that the investigation is currently underway. I can't say whether the cases have been occurring for a long time or a short time at this point. We're working with the state to help us characterize this outbreak a bit more, and we're doing more in-depth investigation with the facility. So we hope to have more information in the weeks to come. But we are doing continual testing with the facility because we are still learning more about what happened there. So at this point, I really can't say. We don't have an index case identified at this point. And I do think there were multiple possibilities for infection there. So more to come in the next coming weeks on what we find here.
Thank you very much. And I understand that we've been working with Alameda County and with the operator on sort of testing and the case investigations. And I know there'll be some additional work, in terms of outreach to the staff there and the people that are living there, particularly in a way that is linguistically and culturally responsive. But I know there's been a lot of sort of work that's happened since we became aware of those cases.
Yeah, there's definitely been some work. We work that there's a trickiness here because Alameda County has jurisdiction over part of the facility and we have jurisdiction over the other. So fortunately, we work very well together. And fortunately, we also are very close to some of the state resources as well. So we're definitely, it's a team effort for sure.
Yeah, I just will say that speaking for myself, we take this issue very seriously. It's very, very concerning. And I appreciate all the work that our staff have done to really try to not just help those people that have been infected and to help control the spread of COVID-19 there, but the testing and contact tracing that's been happening as well. A question around childcare and the reopening of the schools in Berkeley. There was a question, what coordination is being done to ensure that schools can open next year? And specifically, what sort of childcare could be available for teachers and critical service providers? So, Madam City Manager, I don't know if you or want to take this one. I know Dr. Varghese is very, very involved in the discussions with BUSD as well.
Yes, we have been working very closely with BUSD, and certainly if Dr. Varghese would like to chime in further, she certainly can. One of the things that I just like to be clear is that our communication with BUSD has been to just truly provide them with good, clear guidance on the health officer's orders. Now, the decision to open or to not open clearly lies with Berkeley Unified School District in their preparedness, but we're here to support them in that preparedness. I know that the superintendent has been communicating with parents within the city. I'm a parent. I have a 15-year-old attending high school at Berkeley Unified School District. And so there's been quite a bit of communication with the parents. I know in the next few weeks, next few days, they're having several town halls, and that's this week, I believe. And so we invite the community to log into those town halls. You can go onto the Berkeley Public Schools website and find the Zoom link to participate in those calls. But basically, it's complex, and while they would love to open the secondary school campuses and compared to elementary schools, the Board of Education just has not yet established a formal target date for middle and high schools to reopen. They continue, though, to make progress toward preparations for opening so that when local conditions permit, they'll be ready to safely reopen. There are a number of things at play here, both labor issues that need to be resolved, both location issues that need to be resolved in terms of facilities, and then we're working through testing. So there are just a number of things that will be a part of the decision-making factor on when they can actually reopen middle and high schools. So that's pretty much all that I have at this time, but I do invite folks to visit the Berkeley Public Schools website and to see when the meetings are. I do know for middle schools, the webinar will be held on Tuesday, December 1st at 6:00 p.m. And for high school students, there will be another webinar on Thursday, December 3rd at 3:00 p.m. And then for high school students, there's another webinar on Thursday, December 3rd at 6 p.m. So they are also coordinating and recording these meetings. So they will be available on the BUSD YouTube channel, as well as sending out a survey to parents with students in the high schools and middle schools. So thank you.
Thank you.
So I can add a little bit on the city's side of it. I think it's so wonderful to hear from a parent who's really getting this great messaging. So I'm so glad to hear that. I want to say that the elementary schools that did open prior to us going back to the purple tier are under the purple tier allowed to continue to operate. And that includes the sort of smaller pilot model that the school district had been implementing. We, through the Emergency Operations Center, have established a learning community for our schools to participate in, and basically have provided weekly guidance around COVID support and effective COVID response measures. They went through I believe it was a 4 to 5 week series, and that is now morphing into more of a learning community. What do you do when this happens? And we've really created a lot of high quality documents via a school's COVID toolkit that will be, now that it's nearly in complete form, will be published on our website for schools for ongoing availability. And so while schools are not opening now, we are learning a lot from the schools that have opened. And I think that learning will actually give us a leg up when the schools are ready and able to reopen. And we are also similarly just started a similar learning community among our childcare centers. And they are also taking advantage of really being in the know and really being provided that handheld assistance in order to support their reopening. So it's a great collaboration and that we will continue to be engaged with. And I can also see that there's an additional question that was dedicated to the health department around that. Kids who are really beginning to get really weary of not being able to attend school, and some of the mental health challenges that parents are starting to experience with their schools, with kids not being able to be in their social environment. We're very aware of that and very concerned about that issue. We have been talking with the school district about it. We are especially concerned about students and young people that have less access to technology and whose parents may have very heavy work schedules to make online learning very difficult. So we're really going to need to regroup as a community and come together as schools begin to reopen to figure out how we can address both the learning loss and the recovery and the healing that is going to happen for all of our children and our families as a result of this pandemic.
Thank you so much. Moving on to the next question around homelessness. This resident is asking if there's an ongoing schedule for cleaning up around the encampments at University and Interstate 80, and how is homeless outreach coordinating COVID testing and containment in those encampments?
So I'll take the first part of that question, Mr. Mayor, and I'll let the containment question to Dr. Barhus and Dr. Hernandez. But so for Caltrans properties, this is the I-80 corridor, Gilman, and also off of the university on and off ramps above and below. We've been working tirelessly with Caltrans, and we make progress and then it goes back. So, but we're continuing. We are not giving up. Right now, Caltrans is on a monthly, once a month cleanup schedule for our corridor. And of course, that is not enough. And we have pushed hard in trying to ask for more intense and also additional cleanups throughout the corridor. One of the things that we've been doing is trying to find an outdoor location or an indoor shelter location for the unhoused community, and to eventually close off the encampments that are established at this location. But of course, the first priority would be to find housing or some type of shelter for these individuals. But that is the goal. We're working very closely with Caltrans, but it has been a challenge. I will not be remiss in my words. It has been a definite challenge. I do appreciate the mayor and Senator Skinner's efforts in trying to help coordinate the work that needs to happen. There have been several cleanups over the last month, and we've seen progress. But again, if you were to go to those locations today, it would look as if there has not been anything done, but that is not the case. Both the city has gone out and cleaned up at these locations, as well as Caltrans. What we're seeing is an increase in illegal dumping. We're seeing an increase in the number of people that are unhoused in our community. So it makes it a tremendous challenge. Not only that, but some of the folks that are in these areas, not only do they have mental health issues, but they also have addiction issues. And it makes it a very hard challenge for them to manage themselves, as well as for the city and Caltrans to truly get our arms around this thing. But we're going to continue pushing that needle and working hard to address the blight and just the unhealth and unsafe conditions that these folks are living in this area. And again, some of them have been placed into shelter. We have placed folks at these locations, but the numbers are growing and it's increasing. So I will turn it over to Dr. Hernandez for any further comments.
I'll take that if it's okay, Dr. Hernandez. I just want to share that Lifelong Medical is a federally qualified health center that works does a lot of great work in the Berkeley community and other communities as well. They have street outreach teams, medical outreach teams that have been really out and about in the community serving the homeless people experiencing homelessness since the start of this pandemic. They've actually expanded their street medicine, and they are doing like a monthly push for COVID testing and really try to get to all of the encampments and to places with larger populations of unhoused people to offer and provide testing. We do this in collaboration. They do this in collaboration with the IGI lab at UC Berkeley. And I can't compliment their great work enough. They've been a great partner in this endeavor and continue to coordinate with us and other outreach groups to do street outreach during COVID.
Thank you so much. Last question for the city manager. This resident is asking how the city is coordinating with UC Berkeley during football game days to ensure that COVID protocols are being followed.
Thank you, Mr. Mayor. So regarding the coordination with UC on game days, there are still no fans allowed in the stadium. And I think that's important because that has reduced numbers. However, the city police department, we still have 8 extra officers and 2 parking enforcement officers that are working in the South Campus area on game days. And that's specifically to deal with traffic issues, such as towing if necessary, and any other issues that might arise as a result of the football games. So far, we've not seen a significant increase in people traveling into the city to celebrate celebrate or congregate as a result of the games. But in speaking with staff who are in charge of the football assignments, they basically shared that there were no abnormal issues that they've had to deal with during this past week's game as an example. But our direction continues to be to folks is we continue to just educate and to provide warnings if they observe overcrowding in restaurants or even Greek system parties, but those issues have not manifested as of late. So we will continue to be out there and to support our community to make sure that we aren't spreading this virus and that people are adhering. And I also just want to add that UC Berkeley has certainly been our partner in this, and they are also working very close with us on maintaining and making sure that the health officers' orders are being followed.
Thank you very much. So now some public health specific questions, and I'm going to direct them to Dr. Hernandez, although Dr. Vargas might be able to respond to this first question. Has the Berkeley Public Health Department expanded to deal with the chronic enormous scope of COVID?
So the answer to that is yes. What I will say, so I just want to share, I want to appreciate what the mayor said, what you said in the start of this presentation, which is it's very difficult to be a health officer. It's a very unique position in that you really hold the health of a community in your hands. And using the best science you have available, you have to make decisions that really impact the broader community on the day-to-day basis, whether people agree with you or not. And we are lucky enough to live in a community where generally where people are very supportive of the shelter-in-place mask wearing approach. But I can assure you there are health officers in other communities who are threatened on a daily basis, who are disliked, who are disrespected, and who are ignored. That we are lucky to have such an excellent and outstanding and committed health officer who really has been in this pandemic from day one, every day, all the time. I couldn't even convince her to get off email for a day. So that said, that we have a disease containment unit on a regular basis that sits within the Office of the Director of Health, Housing, Community Services. And that disease containment unit, what people don't realize is they are combating communicable disease on a daily basis. I hear stories still of their work with TB. They've done work with pandemic flu. They have done work with H1N1. They have done work with a whole host of diseases that most people don't know the name of, including myself. And they've had a targeted science-based approach for many years. That work, when COVID hit us, the scope of work that they have been doing expanded tenfold. And they immediately, we called people that were skilled, some of our nursing staff from public health into the EOC to support it. We hired some temporary nurses. We really pivoted to provide that work within the EOC. Now that we know that we are going to be living with COVID, it's going to be one of the 30 diseases that they deal with on a regular basis, but with a big C or big D, if you will. We know that we need to actually create a COVID unit within the health officer unit that's really working specifically on COVID. I can thank the city manager who through some grant funds has approved the hire of a temporary deputy health officer. Her name is Dr. Liza Ortiz. She has started with us. We are in the process of hiring some additional public health nurses through some federal grant dollars that we have. We have transitioned some people who will work more long-term within the COVID unit, but we're actually really thinking of a self-contained unit that really is going to be working long-term on COVID. I will also add the addition of epidemiologists so that we're actually leading a science-driven, data-driven process. And she's one of the people that provided those statistics to us that Dr. Hernandez presented earlier. And then we also are working on expanding our outreach capacity so that we can do more broad outreach into communities that are especially impacted by COVID, so that we can do more testing, prevention, education, and destigmatization, as long as providing ongoing resources to people who may have to quarantine or isolate. I think we're looking at space for this team, and I think we've expanded at least triple at this point and have about 21 people in working specifically on the COVID response in the unit, and expect over the next year or two to be able to have to continue the work at that level.
Thank you so very much. You know, the fact that we've been able to kind of adapt and sort of expand our response as this pandemic has occurred is really incredible. And thank you for providing us that information and that update. The next question is, I would direct to Dr. Hernandez. This resident is asking, if a person has had COVID-19 and recovered, is it safe for them to travel and or interact with others, including visiting a person in a vulnerable category? I'm assuming the underlying question within that is, do they have sufficient antibodies? This resident is asking, if they've had COVID and recovered, can they travel and interact with others, including individuals who may be vulnerable to COVID?
Right. I guess I would answer it in two parts. One is the immunity part of the question, yeah, which what we're seeing is, in general, people seem to be immune for about 90 days. So once you've had COVID documented, we're seeing that immunity seems to last for 90 days. And there's a big themes because we're learning more and more about this disease as we go on. As we all know, we've not been dealing with this disease for a year. So we're learning more and more as we do more research on and study on this disease. So one is, we're seeing that there is that level of immunity. However, it is not perfect. We have seen some sporadic cases where there has been reinfection with COVID-19. So it is not a guarantee that you're not going to get COVID-19 again, even within that period of what we think is immunity. So that's one thing. That's the first part of the question. The second part about travel and interacting with others. Within that, once you're deemed not contagious, you can continue to resume your regular activities. However, we still have to adhere to the restrictions imposed by the state and by our jurisdictions in terms of curfew or interacting in social gathering. So just because you had COVID doesn't mean that you can have a party with all the other individuals who've had COVID. So that's not something that's allowed. Again, this is a disease that we don't know much about. So that's the other thing. And also traveling also increases your risk for getting COVID because you're interacting with multiple individuals. And in terms of visiting person in a vulnerable category, I think the best thing to do is for individuals who are higher risk for either getting COVID or getting complications for COVID have to be extremely careful, no matter who you're interacting with. So that's how I would answer that question and give that advice if, say, my mom asked me that question.
Thank you so very much.
Sure.
There was a question around why are basketball courts still, I guess use of basketball courts is really the question, still permitted. This resident had noted that the basketball court at Ohlone Park has daily games where no masks are being worn. And so I guess two questions. One, we did, I think it was several months back, allowed the use of, basketball courts and other recreational spaces. I guess are people required to have to wear masks if they're playing? I think that's kind of a key threshold question, because if they're not, then there's no violation of a health order.
So actually, the basketball courts remain closed. So that is not allowed. Also, the fields are not allowed for soccer games or other contact sports as well. So I saw the question and also wanted to just expand that and not just focus in on basketball, but also all contact sports are really not allowed. The only contact sports that are really allowed at this point are college sports, and that is because they're doing very targeted surveillance and testing. So it's a different situation than someone playing soccer or playing basketball or playing rugby or whatever contact, water polo. Those are sports that are contact, and they're not permitted in our jurisdiction. So that's one thing. People who are exercising are not required to wear face covering if they're alone, but if they're together or in a group that's outside of their household, they should be wearing their face covering.
Thank you. So technically, people are not supposed to use the basketball courts, and you should wear a face covering if you are in close proximity to people that are not in your household. So I guess that would be the response to the question. But if somebody sees use of soccer fields or basketball courts, I know that it's not as high a priority as large gatherings. But Madam City Manager, what should people do if they see that occurring?
So they have two opportunities here. They should call 311 and report the actual occurrence. But when it's happening, it's best to call non-emergency, the police non-emergency line, because a lot of times these activities will require police response. And again, our approach is to get there and to educate folks and to ensure that they are understanding the rules. So sometimes folks think that things were lightened, they were lessened, or we allowed for certain activities to happen as they see things have changed. But again, we're in the purple tier, and that purple tier, those were restrictions definitely at that time. And to my understanding, we have not allowed for basketball playing to occur in the city. So they need to report it. And I would expect that we will get to those calls as quickly as we can. And of course, either 311 or non-emergency. Thank you.
Thank you very much for that clarification. So there's a question around the statewide stay-at-home order, which specifically states that people should be home by 10 o'clock and sort of discourages gatherings of people after 10 o'clock. This resident is asking, if my brother is having dinner with us on Sunday, he usually stays until 12, I'm assuming 12 a.m. before driving home to Emeryville. Does he have to leave my house in time to get home by 10 p.m.?
Yes, he does. And I'm hoping that he is part of your 3 household gathering group. And the curfew is for non-essential activities to cease by 10 p.m. and not occur between 10 p.m. and 5 a.m.
Thank you very much. There was a question around Santa Clara recently announcing more restrictive measures, including reducing capacity for retail. As you noted, Dr. Hernandez, people who are traveling have to quarantine for a certain period of time, prohibiting people attending professional sporting events. This resident's asking, could similar measures be likely in Alameda County in the future?
As I mentioned in the beginning of this town hall, we are looking at different strategies to flatten the curve once again. So there could be some restrictions that are similar to Santa Clara's that may occur at the county and the city level, or could be imposed by state restrictions. As you mentioned, Mr. Mayor, the governor talked about that today at his conference, his noon conference. So there's a possibility that we will see some changes in our stay-at-home order in the next weeks, in the next couple of weeks, if not sooner, either through statewide actions or through local health jurisdiction actions.
Okay, there are a few questions around testing. Before we do that, I just want to clarify something you had said, and I think this is particularly important as we're entering the holiday season. You had mentioned, and I think we talked about this as part of the guidance we had issued to families prior to Thanksgiving, that 3 households can gather, but they have to kind of limit their interactions to just that pod for a certain period of time.
Yes, and outdoors.
Outdoors.
Yes, so it's a short. There are 3: a short, stable. I should have memorized them or put them on my arm. Short, stable. So you want short duration, stable group of individuals. You want it to be outdoors, and you want it to be, I forget what the last S is, but essentially, I used to use this to like memorize all my information for med school. So you know how long ago that was. But anyway, basically it's allowed for 3 households, but it should be outdoors. People can go indoors to use the restroom briefly. But other than that, it's a stable group of individuals. You also want to make sure that these individuals have similar practices when it comes to physical distancing and wearing face coverings, so that you're not mixing with a group that will put you and your family at higher risk.
Thank you so much. I think the clarification is outdoors, not indoors, I think is important for people to understand.
Yes.
Few questions around curative, and this is a question I think that was asked previously. How reliable are the curative tests, and how quickly are people getting results? And then there was a question/comment about that curative on San Pablo seems to be booked solid every single day. So I guess it's sort of 3 questions: how reliable are the tests, how quickly are people getting the results, and just noting that there's been a huge demand for testing, particularly leading up to Thanksgiving and leading up to the Christmas holiday. And so how long is the wait to be able to get tested?
So we have 2 city-sanctioned test sites in Berkeley. One of them is curative at the Berkeley Adult School that operates 6 days a week from 9 to 6. And the other one is the state-run Optum test site that is operated at YAP, which is open daily from 8 a.m. to 8 p.m. The curative is very popular because they started off with this self-administered saliva test that people like. It's simple, easy, and fast. So they now have, and so they have sort of become sort of the talk of the town. I was tested at curative a couple of weeks ago, and they say 24 to 48 hours. In this case, it was a really high volume day. I got my results back in it was a little more delayed, 55 hours, but I think overall they're very good at that 24 to 48 hours window. They do fill up very fast. So what they do is they open their appointments 1 week in advance, because they want to make sure that people aren't resubmitting, and that's their way to actually increase accessibility. But they do tend to fill up fairly quickly. The Optum test site can serve, so the Optum test site, they test about 140 clients a day. However, as of today, they doubled their capacity. So now you're able to be tested, I think they can test around 320 tests per day. And they actually have a lot of capacity right now because they just reopened. Their test results right now, they have been a little slower. They are state run and so have been subject to the slow lab times that people may have heard about a few months ago. They are getting better. Their current average turnaround is 70 hours, which is, just a little under 3 days. So not terrible. And I want people to know that they do not utilize that scary, and Dr. Hernandez could give the medical terminology, but I call it the stick into the brain method. They did do that in the beginning. People found it uncomfortable, but they no longer use that process. It's still a nasal swab, but it involves very little discomfort and is a quite easy process. We had a person contact us today that needed to get testing. She went to that site and reported back that it was very pleasant. So I want to encourage people that if you can't get in at Curative, if they book up, I really suggest that you contact the Optum site and try to make an appointment there. I'm sure right now you could probably get same day appointments. And we actually really need them to build that capacity, because if they don't get to their full capacity, we might lose part of their site to another jurisdiction. So I'm going to plug that site for a bit.
Excellent. And people can go to the City of Berkeley website, cityofberkeley.info/COVID-19, and there's a link for information about both those testing options. I will confirm, having been tested at Optum within probably the last 3 or 4 weeks, that it is more comfortable. So you have to worry about thing being shoved up your nose. It's a lot more comfortable and actually very convenient. So we would definitely encourage Berkeley residents, if you're not able to get tested at Curative, to please sign up to get tested at the Optum site on Oregon Street. And it's great to hear that we're increasing capacity. That's really encouraging. Thank you so much. A couple of questions around the vaccine distribution. And there's been a lot of planning happening, but we're months away for the wide disbursement of a vaccine. So the first question is, how will we ensure that the city receives sufficient number of doses for first responders and teachers to receive it? And then there's a question around pricing, and there's a concern expressed that the vaccine may be financially prohibitive. So what role will the city, and I would imagine other jurisdictions, play to ensure that those without health insurance are able to get access to a vaccine?
So planning has been underway for months on the COVID vaccine, and we use some of the strategies that we've used before for vaccine distribution, whether it was for the whooping cough vaccine 10 years ago now, or H1N1 vaccine as well. So we are using those same strategies and formulas to plan for this vaccine. This vaccine's a little more complicated, one, because it's a new vaccine, two, because there's multiple formulations. And we're still in the planning phases and approval phases at the federal level for this vaccine. That said, we will be getting our specific vaccine allotment here in the city of Berkeley, and they're going to be phasing in the vaccine. The decisions on how the phasing will occur is still being finalized at the state level, but we will get a phased allotment that will be distributed. Some of it will come to the city health department ourselves, and then some of it may go to some of the healthcare partners. So we're still figuring out those logistics with the state, but again, we're waiting for the feds to go through their process of approval. So more to come on that. But we're definitely in the planning phase. We're readying ourselves for the distribution and using some of the work that we've done in the past for vaccines, and actually even for flu vaccine. We administer flu vaccine annually, some to our healthcare partners, our skilled nursing facilities, and others clinics in the community, as well as doing our own point of dispensing exercises throughout the city. So we're readying ourselves, and as soon as the allotment is here, we will be communicating how that will be distributed. And we're also working on a communications plan for the community, so they're aware of what we're doing, how it's rolling out, and when they can get vaccinated. And then the question about cost, basically, the only cost that is allowed to be charged for the vaccine is administration fee of $25, no more than $25 for the vaccine. We imagine that most places will be able to charge insurance for the vaccine, and we'll have a supply as well. So we're going to ensure that people have access to the vaccine, and that the cost is not prohibitive to them to get it when it's available.
And to that, I just want to add the same around the cost of the COVID test. So if people need to be tested and they don't have insurance, they can still be tested at either the Optum or the Curative sites.
Thank you so very much. So more to come about the distribution of vaccine or vaccines. And thank you very much for providing that very helpful information for us to understand the planning and the potential rollout. There were a couple of questions that were more related to city policy that I wanted to address. There was a question around why individuals facing unsheltered homelessness have not been placed in dorm rooms, hotel rooms, or apartments yet. And I just want to acknowledge that there's been significant effort over the past several months to provide shelter for individuals experiencing homelessness. The Safer Ground and respite programs have been underway. 111 individuals have been given shelter in hotels in Berkeley. This is in addition to ongoing non-COVID related efforts to provide permanent housing. And so we are also looking at how to sustain the hotel placements for those people who participated in the Room Key program. We're looking at opportunities to acquire existing hotels or master lease properties to provide permanent housing. We're looking at creating an outdoor shelter to provide additional sheltering options in a way that allows physical distancing and is compliance with public health protocols. We're also going to be, I believe, Dr. Varus, if I'm not mistaken, we're going to be having a winter shelter that we're going to be opening. If I think you had mentioned that previously, that's going to be in operation throughout the winter season.
And I believe it started today was the first operational day, and the outreach teams have been actively making placements.
Excellent. That's great. So, quite a bit has been done and will continue to be done to provide shelter and ultimately connect people to permanent housing. Unfortunately, we know that the state Room Key program, that the funds are at least my understanding, are unless something's changed, are not going to be sustained. And so we need to look at ways to kind of continue to provide shelter accommodations for people who participate in that program. We've acquired trailers where we put people who are sort of vulnerable to COVID in those trailers. So we're looking at a variety of ways to expand access to shelter. There was a question around outdoor dining and retail and whether they will continue to operate during the winter and inclement weather. Obviously, this is dependent on, the cases and just the data. But at the present time, outdoor commerce is allowed in a variety of business sectors, including in food service and restaurants. And I want to announce that the Berkeley City Council tomorrow will be considering a proposal to initiate a grant program for existing businesses to be able to apply for city funding to transition their business operations outdoors during this winter season. We've heard from many restaurants and other businesses that they're not prepared for winter. They don't have heat lamps. They do not have the infrastructure to be able to operate outside during the winter season where there's anticipated to be rain and cold weather. And so we want to be able to assist businesses to be able to transition their operations, to be able to conduct business outdoors to the extent that it is permitted. Because we know with the increasing number of cases and now being back in the purple tier that it's going to be some time before, most likely before indoor dining is going to be permitted. So outdoors at the present time is permitted. It is safer, but we need to enable businesses to be able to operate in that environment. So the grant program is one thing we can do to help support our businesses. I also want to announce that this past Friday on what's called quote unquote Black Friday, or the sort of the launch of the Christmas shopping season, we reactivated the Berkeley Relief Fund, which was an initiative that we had launched the day the shelter-in-place order took effect, and this fund, which the city and our community partners have helped grow over the past several months, has raised about $4.4 million, which has provided grants to our small businesses, to our arts nonprofits, and to help tenants facing housing insecurity. We raised about $1.5 million in private donations. And I want to thank the Berkeley community for your incredible generosity. And so we're relaunching a second round of the Berkeley Relief Fund as we're approaching this holiday season, and really encourage the Berkeley community to not only buy local, to support your local businesses, to use your pocketbook to help support your community during this time so our businesses can get through this pandemic, but to also consider making a donation to the Berkeley Relief Fund so that we can provide additional economic support so that these businesses can stay open. Sadly, many businesses have closed in Berkeley and may not reopen, but we want to be able to continue to support our small locally owned businesses, which are really the lifeblood of our tax base and also of our neighboring commercial districts. So please go to Berkeley Relief Fund, all one word, berkeleyReliefFund.org, to donate. And thank you to the Berkeley community for all that you've done these past few months to help us support our community. And we're asking for your support once again as we're entering this holiday season. So thank you. So those are all the questions that we received for tonight. And I want to give our panelists the opportunity to say some final words before we close. So I'll go to Dr. Hernandez. Any final comments you'd like to share with the Berkeley community before we close?
Sure. I hate giving such sobering news. So I just wanted to end with thanking everyone for doing their best to keep each other safe. This has been a really tough time. I hear it in the questions that we have today in terms of the impact, not only on the community as a whole, but on our children. And I know this is an extremely tough time. And I just want to wish everyone well and thank everyone for doing their best to wear their face coverings and physically distance as much as possible, because we know those strategies really help control this disease that we're still learning more about day by day. So I just want to extend my thank you and my appreciation for the support during this really tough time.
Thank you so very much, Dr. Hernandez, and thank you for all your incredible work. We're so fortunate to have such an incredible leader leading our city during this crisis, and we appreciate you.
Okay, enough embarrassing me, please.
Dr. Varhus, any final comments you'd like to share with the Berkeley community tonight?
So I'm relatively new here in the city of Berkeley, and I just am so honored to be teaming up with both the health officer and the city manager and you, Mr. Mayor. I have had so many comments like, how could you start a job like this in these times? And I can't say, I mean, these are really intelligent, brilliant people. And there are many, many more in the city. And the work that we have done thus far, I'm really proud of. I hit the ground running, but the ground was already going because of the talents and skills of people. So I want to assure the community that we really do have good people that are doing really great work and totally committed to making this work. And so I just want to share how much I appreciate being here, working here in the city where I grew up and where I went to school and where my kids went to school. And just also want to wish everybody safe and happy holidays.
Thank you so much. Madam City Manager, any final comments you'd like to share with the Berkeley community tonight?
Yes, thank you, Mr. Mayor. And I echo all of the sentiments for Dr. Hernandez and also Dr. Varhus. It certainly was a bowl of hot water that we just threw you into and asked you to swim. So thank you, because you swam well and you are just meeting all of the challenges. So we do appreciate your leadership as well over the department. Mr. Mayor, this has been, an ongoing thing for us. And I want to applaud you for continuing these town halls and giving us an opportunity to really connect with the Berkeley community. They've been awesome in this pandemic, and we appreciate them. And I'm very grateful to our Berkeley community. One last shout out for this holiday seasonal shopping is for folks to visit the berkeleyholidays.com and check out discoveredinberkeley.com just to see more about just the innovative businesses in Berkeley and learn about how the city supports our Berkeley businesses on our Office of Economic Development webpage. So I invite folks to stay home, shop online, do your best to just try and stay safe out there. And we are all in this together. I know you hear that term a lot, but we truly are all in this together. And there's no way around it. So thank you for continuing to support your city workers and your elected officials. So thank you and have a happy holiday, everyone.
Thank you so much. And I just want to thank the three of you for taking time out of your very busy schedule to participate in these town hall meetings. I know the Berkeley community really appreciates it. And I learn things every single time I participate. So it's incredibly helpful. I think our community really appreciates hearing directly from the decision makers and getting important information around this pandemic. So thank you for your ongoing participation. In closing, I just want to reflect on something I heard President-elect Biden say in his Thanksgiving message, which I thought was a very important and inspiring message. He talked about COVID fatigue, and I know we are all fatigued. I'm sure Dr. Hernandez is more fatigued than probably many people, but this has been a really difficult year. And we're almost done with 2020. And so we need to get through this year and make it to the next year. Make sure that all of our neighbors can make it safely through the next year. I know it's been hard. It's required enormous sacrifices on every single person's part. People that have gotten sick or sadly who passed, caring for family members who are sick, people who have to completely change the way that they live, working remotely, looking after their kids and their distance learning, people who've lost their jobs, businesses that have closed. This has been one of the most challenging times in the history of our country, and certainly in the history of our city. But I am really amazed and inspired by how our city has really risen to the challenge. And we need to continue to stay vigilant these next few days and weeks and months, because this is the most critical time. All the progress that we have made to help control the spread of COVID-19 could be reversed. And we could see more of our friends and neighbors who become sick. So I implore the Berkeley community to continue to stay vigilant, to continue to follow the shelter-in-place order, to practice physical distancing, to wear your face covering, to shelter in place. It is really critical. It has made a difference, and it will continue to make a difference. So let's get through 2020 safely. Let's get our community through this and hope that next year will be safer and better, and know that we have gotten through this together. Lastly, once again, I want to make one more plug for the Berkeley Relief Fund. We are relaunching this fund. This has helped over 700 small businesses in Berkeley stay open. It's helped 63 arts organizations, many of whom will not open until next year, also continue to stay open. And it's helped hundreds of households in Berkeley who were on the verge of homelessness and are facing significant rent debt. This is one way that you can give back to your community and to help support your community during this difficult time. So please go to berkeleyrelieffund.org, all one word, berkeleyrelieffund.org to donate. Thank you so much to the Berkeley community for your generosity. Please stay safe, and we will see you at our next town hall meeting. Thank you.